to the Wing Space podcast, a place to take up space, a space for you to settle in, sit back, relax, and focus a little bit on health, wellness, faith, family, and this crazy thing called life.
This podcast is not a replacement for mental health treatment or professional health care. In case of crisis or emergency, please contact your local healthcare provider or dial 911.
Hey there, and welcome to the Wing Space podcast, a place to take up space. Welcome to season 3 of our podcast, and I'm with a guest today for our small mini season where we're going to just be chatting with some community members about some really important topics. And I'm excited to have Jenna Holmes with us today. Jenna, it's so good to have you here on the podcast.
Absolutely. Thank you for having me.
And so Jenna is one of our newer members here at Hope and Healing in our center, and I'm really excited to talk about what Jenna does. So from a professional standpoint, Jenna, tell us what it is that you do.
So I am a physical therapist, and I specialize in treating pelvic health dysfunction. I have been treating since 2008. That's when I graduated. I took my first pelvic health course in 2009, but I didn't really dive deep into pelvic floor dysfunction until around 2018. And so really since that time, all of my focus with continuing education and all of the podcasts that I listen to, everything has really been geared towards pelvic floor dysfunction. It started helping women with pelvic floor dysfunction, and I've kind of been able to expand that to also be able to help men in this setting, because it's crazy to think that men can be even less represented.
Many of our listeners are probably thinking, okay, I know what physical therapy is. Maybe they've gone to physical therapy, post 5 knee surgeries. I've definitely had my fair share of physical therapy, but what is pelvic physical therapy?
So with pelvic physical therapy, we still look at you as kind of a whole person and a whole body, but we have additional training to more specifically address the muscles and tissues and organs in the pelvic floor. So a lot of the time, we kind of forget that everyone has a pelvis. We tend to think that it's kind of only a women's issue or only a pregnancy and postpartum issue, but we all have muscles in the pelvic floor. We all have organs in the pelvic floor, and those muscles really have to be able to work effectively within the other systems. And so we just have additional training and additional skill set to be able to address those spaces.
And what I'm hearing you say is that everyone can benefit from pelvic therapy.
Potentially. So anyone who's dealing with issues like urinary incontinence, fecal incontinence, constipation, difficulty with kind of knowing whether it's gas or stool, pelvic organ prolapse, or any along these lines can be addressed by pelvic floor therapy.
So how might physical therapy for pelvic floor dysfunction differ from regular physical therapy? I'm imagining when I have gone to physical therapy, it's a big open gym. Everybody's on there. They've got weights, they've got machines, they've got mats, they've got all the things. I know, because you're in our space, that there is not a big open gym where everyone is doing this together. So tell us how it differs.
So we're in a private treatment setting. Especially during that first session, we're going to take time. We're going to talk about kind of what you're experiencing, what your symptoms are. We'll ask a ton of personal questions. So really, there's nothing that's kind of too much information. I want to know all about what's normal for bowel function, what's normal for bladder function. So the beginning of that physical exam may look pretty similar to what you would see in a regular orthopedic clinic. I'm going to be looking at range of motion around the spine, what your standing balance looks like, all of those things. But then there's an added component where I'm looking at breathing. I'm looking at your abs. We also do a direct assessment of the pelvic floor. So that exam is a little bit different than a GYN exam in that there's no stirrups, there's no speculum, but I'm looking more kind of externally first. Where are the tissues positioned? Are there any signs of inflammation? What happens with coordination? And then with the internal part of the exam, we have 3 different muscle layers in that space. And so we're basically going to map through those 3 different muscle layers. And I'm looking for things like tone, tension, tenderness, that sort of thing, to let me know kind of what's happening with your body. One of the big misconceptions, I think, with pelvic floor therapy is that it's just Kegel exercises. Just contract and relax your pelvic floor. And people will get into trouble because they're trying to do contractions they've never really had to think about before. In a perfectly functioning system, you shouldn't be thinking about, oh, let me pause, let me lift, let me try to pull everything in before I do this activity. Things should just work. Never thought about it before you had a problem. We want to get that system back to functioning to where you're not thinking about it.
I feel like this is certainly a conversation that could take us down many, many pathways. For those people who are listening and say, okay, Jen, I understand why you have, maybe they understand why we have massage or yoga or fitness here within our wellness center where I wouldn't say primarily, but a lot of our clients that we work with are trauma survivors. So they're probably thinking, okay, so where does pelvic floor physical therapy fit into this? And how does your work fit into the other work that we're doing here in our center?
So, one of the biggest things that I see with a lot of my patients is kind of this upregulation of the nervous system. It's their body is kind of always in that fight or flight mode. And even when mentally they're trying to tell themselves to be calm or they feel like they're in a good space, their body may not necessarily be following along with what their brain is kind of telling them, what they're actively telling themselves. And so a lot of our time ends up being spent on trying to help with regulating the nervous system. So, one of the other things, if you're not thinking about pelvic floor contraction, you're thinking about pelvic therapy as a lot of breathing exercises. We do a lot of breathing exercises, but the intent is more for giving you strategies to try to help control what your body is experiencing. And if you think about just kind of that trauma piece, that anxiety piece, all of those things are pieces of the puzzle that we're trying to help manage from a more physical or biomechanical space, while you're kind of working with your therapist to address more of the emotional component to it, and some of the other strategies. So it ends up being kind of a nice sort of blend, something that can be used in conjunction with the therapies that are also being offered here.
What you said was really important for our listeners, our viewers to hear, and that is the dysregulation of the nervous system. It is so important and very likely going to be maybe even a mini series of its own here soon on the podcast, because it really is important for people to understand that if they're living in this constant fight or flight mode, their body just doesn't know how to interact with the world around it. And when we think about the pelvic floor, a lot of people think about their core, and we really do have to think about the core of our body. If that system is not optimized, then all of our vital organs are within that pelvic floor region. All of the systems that need to get things moving and grooving are right there and can be impacted by that dysregulation of the nervous system, which can happen from chronic stress, not just from, a big T trauma. Some people say, oh, I've never experienced trauma before. Well, we've all lived through a global pandemic. We've all lived through, economy struggles and, school issues and all kinds of just societal things that are happening causes stress in our lives, in our body, because we hold on to it. So how can you explain the collaboration that we can have from the work that you're doing and the work that we're doing, and maybe there's some other healthcare providers that someone may be working with that can be a part of this interdisciplinary care?
Absolutely. So let's use just a woman as an example. Depending on kind of what she's experiencing, a lot of what I see is chronic pelvic pain. And so chronic pelvic pain tends to go hand in hand with constipation. When we look at constipation, that tends to be kind of a multifactorial issue. When I'm looking at that system, I'm looking at a lot of the biomechanical things that are impacting that, and I'm looking to help with managing the nervous system. So if she can work with a therapist to kind of get coping strategies or different things to help her with managing stress, that's going to be one way that we can start to help regulating that system. I can give basic information and basic education on that, but that may be a great opportunity to pull in a nutritionist. One of the things, depending on the person, that can be super helpful is touch. So we'll do a lot of touch in other spaces. I will tend to work a lot around kind of that suboccipital region, kind of through the neck, around the jaw, because that's one of the areas that we tend to hold a tremendous amount of tension in that can impact what's happening in the pelvic floor. If there are other things that I feel like I need to focus or prioritize more in a session, that may be where I encourage someone to reach out for massage. Can we get a massage therapist on board who can help with regulating some of the tension that's just kind of generally being held in the system? And so, depending on kind of what we're seeing, we may have kind of an entire team working with someone to really optimize what's happening throughout their entire body system.
What I'm hearing is very similar to the wellness model that we use here at Hope and Healing, is that, we understand that talk therapy isn't the only route for wellness. And sometimes in Western medicine, people tend to say, it's one doctor, one shop, one set of medications. And really what I'm hearing is more of a holistic approach to the wellness, because it's all of the components. It's so interesting the way that our systems are all connected. And I know for me, I do carry a lot of stress and tension in my neck and in my shoulders. I don't know that I would ever think that that was connected to anything that's going on in the core pelvic region. So it's great for our listeners to understand that, everything is connected within our body, and they may need to reach out to another provider, another expert, because as much as we might love our primary care physician, they're a generalist, right? And they're within their swim lane, they're within their scope of practice. There's a reason why we have experts like you who know things about other things that can help impact our overall health and wellness. So I know I'm really excited. Jenna, you and I have talked about how from a trauma perspective, we can really do some good work with our clients who are having some of those like you said, constipation and other type issues, but they're also a survivor of sexual assault or domestic violence or some other kind of trauma, because the whole system then becomes connected.
Absolutely. And so, especially here, if we can work together and kind of get a good understanding of what's happening, what has happened to someone in the past, to make sure that things that I'm specifically doing are not going to re-traumatize someone, and things that I'm seeing, I can provide that feedback for you, just so that you're able to kind of help address those issues as well. There are a lot of things that we can do without ever directly touching someone's pelvic floor. And so consent is a huge piece. Boundaries are a huge piece here. And that's one of the conversations that I have with every patient. So if we need to stop anything for any reason, even if you don't understand what that reason is, it's totally fine. We're going to be respectful of that, because we want to create as many positive associations with this space in our body as possible.
Yeah, I love that. Having the client, having the patient be in charge of the care that they receive, just so that folks have an understanding of where in our center this service is offered. You are in one of our bodywork spaces, so a private space. Massage table is kind of the exam table. It's not institutional. It doesn't look like a doctor's office. It looks like a massage therapy space. So the lights are on or off as needed for the care. And sometimes I know that you've gone into our studio space when you've needed maybe a little bit more extra room to work with one of your clients. So it certainly is private, it's confidential, and we take great care in all aspects of the work that we do, but specifically because what you're doing is so personal and private, we want to make sure that people understand that this is a private setting and very individualized care.
Absolutely. And it's also not always only, it should never be only direct work in the pelvic floor. So if you're coming in for a session, we may have entire sessions where there's no hands-on work. We may be looking more at movement and trying to get your body kind of activating your muscles in a slightly different way to help reduce the stress that's being placed on the pelvic floor. So therapy looks different for each person that's kind of receiving it. So in some cases, we may be doing breath work and calming the nervous system. In some cases, we may be using stretching to try to help open and create space around the pelvis or around the rib cage so that we can better manage pressure in our system. In other cases, we may be lifting weights. We may be looking at kind of a more of a pressure management piece. And so the fun part about kind of the way that I practice is I can offer services here. I can also offer services in your home. And so if you're an Olympic weightlifter or a CrossFitter and you've got equipment at your house, let's go move a barbell. Let's see what your body looks like. And let's make sure that there's nothing in the things that you're doing, the things that you love, that we need to adjust to help make sure they're not impacting the symptoms you're experiencing.
I guess I'll say selfishly, I'm so excited that you're here in our space that I neglected to mention that you do mobile work as well. So thanks for mentioning that you do go into people's homes, whether they're unable to come into the center for their services, or like you said, if they have something in their home that they need to use in terms of their daily functioning that is important for their care, then you go into their home. Anything else that folks should know about the importance of pelvic health, the services that you offer?
I think the biggest thing is just don't be afraid to talk about it. Don't be afraid to ask for help. A lot of the time, this area of our body, whether it's bladder function, bowel function, sexual function, it tends to just be very taboo in terms of people not feeling comfortable discussing this. But we all pee, we all poop, most of us are having sex. It's okay. It's a normal part of life. And really, it's a very judgment-free space. So even if you're coming in just to learn about whether or not what you're experiencing is normal, that can be very powerful as well.
That's awesome. So Jenna, how can people get engaged in your services? And I guess as you answer that question, can you talk about like payment, insurance, stuff like that?
So the easiest way to contact me is actually through our website. There's a contact form there, and it gives me information about what's best for you in terms of phone call, text message, that sort of thing. I do a lot of patient care most days, so most of the times that I have to be able to respond to those messages are typically later in the evening or early in the morning. So usually a message is going to be easier than a phone call just because it's hard to catch me on the phone. In terms of kind of how I work a little bit differently than a lot of physical therapy clinics, and that I do not work directly with insurance. I do provide a super bill though, so if your insurance has an out-of-network benefit, you should be able to use that to assist with reimbursement. And then if you have an HSA or FSA, you can also use those accounts. Everything is done, I have a patient portal, so everything is handled kind of through that patient portal. So there's no need to worry about having cards with you or anything like that. Everything is done online.
Awesome. We will make sure that we link your website in our show notes when we publish this episode so that our listeners have access to that. And, while we're talking, I have a couple little ideas of things that you and I might talk about more in the future, because I think it's really important that what you said a few moments ago is to not be afraid to talk about it. And sometimes there are topics that are considered taboo or people just don't want to talk about it. It's too personal, it's too private. But the reality is, most things are not individual to one person. There's a collective group of people that are experiencing the same thing. Hence the reason why there's a specialty in pelvic health, physical therapy. And we need to talk about it, and we need to bring it out into the open. We need to remove the stigma in the same way that we're working hard to remove stigma around mental health as well. So Jenna, thanks so much for chatting with me today. Really excited to have you here as a part of our team and an additional service for our clients. And for our listeners, if you have questions for Jenna or information, we'll make sure that we have her information linked in the show notes. And I thank you for listening, and I hope you have a great day.
Absolutely. Thank you.